In the operating room, I work with a urologist, and we use two technologies to place the needles very accurately. One is transrectal ultrasound. We do that by placing an ultrasound probe in the rectum, and we can see the prostate gland very clearly. The other technology is fluoroscopy, which uses a low-dose X-ray to help us make sure our needles are parallel. After we place the needles in the operating room, a patient spends a few minutes in recovery. Then we take him to the imaging part of the hospital, where he has a CT scan done that goes from above the needles down well below the prostate gland. We take many images of these needles, and they are sent by means of a wire into our treatment planning computers, where I sit down and delineate what we call the radiation target. In addition, we also delineate on these images the normal structures that we need to protect, such as the bladder, the urethra, and the rectum. After I've delineated a target, a highly trained medical physicist then uses advanced computer programs to plan a radiation dose which I prescribe. The patient is brought into a special room called a vault, where he's attached to a machine called a remote afterloader. The robotic afterloader sends the radiation source inside these needles with a high degree of precision and accuracy. So there is no question that we are delivering the dose that we want to deliver. The radioactive seed that we use to treat prostate cancer in high-dose rate brachytherapy acts like a very small gamma ray star. In a certain location within the prostate gland, it emits gamma rays in every direction. Because it is a very small source, the dose immediately around the seed is very intense. Furthermore, most of those gamma rays are absorbed in the tissue immediately around where the gamma rays originate, delivering a very potent dose of radiation in a very short period of time. That treatment takes about 20 minutes, after which he is disconnected from the machine. He stays on his gurney, and he returns to his hospital room. After treatment with high-dose rate brachytherapy, most patients have minimal discomfort. Most of them go back to their routine activities within 2 or 3 days. Over a period of about 2 to 4 years, the PSA will drop to an undetectable value. It is a great comfort for me and the patient to know that the PSA is undetectable, and it is also a strong predictor that the cancer will never return.